Hey guys, welcome to the ATP Project. You're with your hosts, Nic and Steve.
How are you, Nic?
I'm good. How are you, Steve?
Good. I feel good today. It's as if I've been taking drugs or something.
I love your lead-ins.
I know, they're good, aren't they?
I don't know if you think of them beforehand or you just off the...
I just made it up then. It wasn't that clever.
No,
but we are talking about drugs, so aren't we?
Pharmaceutical drugs, prescription medications.
They can be
so
fun.
Let's just clear that up. Yes,
Yeah.
Yeah. So we're actually going to talk about interactions with drugs, interactions with herbs and nutrients.
Yeah.
Because it's really common.
Yep.
And in clinic, I get clients come to me that many times are taking pharmaceutical medications. So we have to then take that into consideration when we do protocols and things. What can we give them that it isn't going to interact? So we're going to talk all about that because I think a lot of people maybe aren't aware of the fact that just because something's natural, as in herbs, there still can be interactions. So
Huge
you need
ones.
to be careful about it.
There's some real severe ones and there's some minor ones. And in fact, there's some beneficial interactions.
There are.
Which we'll talk about too. So it's very interesting. But a lot of people take medications regularly. You know, the most commons are the statins in prescription medications, but you might be on an over-the-counter drug. We've talked about PPIs before, but, paracetamol is a drug, ibuprofen. And ibuprofen has got some interactions. So we've got lots to talk about today. We're struggling. Like, how do we tackle such a massive topic?
Yeah. Well, I think the first thing we should say is we'll put all the disclaimers in at the beginning.
Oh, yes.
Do not go off any medication.
Nope.
If you're taking a herb and we say there's an interaction, do not go off your medication at all. Talk to your prescribing doctor.
Yep.
We're not saying anything about that. We're just saying these are the things to be careful of. And if you are having some strange symptoms and things, then possibly there could be something going on there. So yeah, I mean, it's a big problem because a lot of people will just go out and self-prescribe supplements and herbs, not thinking about the fact that they might be on medications and there could be some interaction. So that's a really common thing I see people, and I'll even treat people in clinic and they'll come back for another appointment and suddenly there's all these other supplements in there as well that I haven't prescribed. I'm like, just be a bit careful about some of these. So you do have to be aware of, what you're taking if you're taking medication. Well, even herbs, or they can sometimes interact.
They can
interact,
yeah, they can.
So you've got to be a bit careful.
It is. It's quite scary. I mean, probably the largest offender we're going to get to today, when I say offender, it means interactions, is hypericum, which is St. John's wort. Yeah. Which you can get. I can go to a pharmacy down the road there and I can pick up strong hypericum with standardised hypericin, go straight to the checkout, and the person at the checkout goes, "Thank you, that'll be $20, $30, thanks, bang." And you don't. There's no checking.
Well, they don't ask if you're on any medications,
do they? They do not ask you. I mean, there may be a label on it that says, don't take interactions with this, but then there may not be.
No.
And there may not be known interactions, and it may be unique to you. I mean, one interaction here, there was one case study of one interacting, so they've put that as a warning.
Yes.
So, and then there's some that, we're going to talk about a drug later, where there's been 30,000 cardiovascular events, and then they withdrew it.
Yes.
So
there is a lot of bias. I mean,
a little bit.
Look, you might go into that.
So I want you to define some terms down. Pharmacokinetics. Kinetics means the movement of.
Yep.
So pharmaco means drug. So what does that actually mean?
Yeah, so when we're looking at how herbs and drugs interact, there's two sort of ways when we look at it. We look at pharmacokinetics and pharmacodynamics. Yes. And that's basically how the drug works. So basically pharmacokinetics kinetics means movement. Yep. So pharmacokinetics basically means what the drug does as it moves through the body. Sure. So the timeline of the drug's absorption as it moves through, its bioavailability, its distribution, metabolism, and how your body excretes
half-life, etc.
Yeah, all that
and we use that because mainly doctors use half-lives and pharmacokinetics to work out when the best time for a drug is.
Yes.
One I can think of It's Viagra. It's the only one I think of at the moment. Sorry, it's terrible, isn't it? But I see your blue shirt, and it reminds me of the.
Oh, is that right? It's my fault. Yeah.
So sildenafil, which is Viagra, that has a half life of about 8 hours, because there was a newer drug, Cialis, that has a longer half life of the whole weekend.
So maybe explain half life first, because some people might not understand what that means.
Sure.
Yeah.
There's two. When you're taking medications, there's two key aspects, of course, dosage, but half life is how long it takes for half the drug to leave your body.
Yeah.
So that's important. So, like for example, with sleeping tablets, there's short, medium, and long-acting ones. The short ones have got short half-lives, about 2.5 hours. And they're usually the Z drugs, Zolpidem, and those sort of things. Yeah. Then you got temazepams, about 5-6 half hours. Then you got the Mogadon long-acting 10-hour ones, which are a lot longer. And Valium is the longest of them all, it's 24 hours. So, you know, and that's important, because if you're like a nervous wreck, the prescription of Valium is just low 2 to 5 milligrams every day, once a day, because it hangs around your body, it sedates you for a certain period. And but if you need it to help you sleep, you want it to hit you fast and get out of your body, so you wake up in 8 hours and you feel refreshed. So that's that half-life, and the half-life is important for that. And the peak time is interesting if you want to, like the Viagra is 2 hours, the classic one where you take it, at say 7 o'clock. With foods, doesn't matter with food, that one. And then, at 9 o'clock, if you're ready for the event, then it's peaked in your body and you can use it. You don't take it and then go, let's go, and nothing happens. So that's it. So it's very important, those two things. And
it's important when we're prescribing prescribing supplements as well, to know how long apart do we keep them, and that sort of thing. So knowing half-lives and things is really important for that as well. So pharmacokinetics, that's what that is.
What the drug does to the body. So, for example, it's like, pharmacokinetics would be a COX-2 inhibitor. We're going to talk about that later, which is an anti-inflammatory. So what does it do to the drug in the body? It inhibits COX-2. Well, how does it affect the body? It reduces inflammation. So it's a little bit of the same sort of thing, but it's really interesting.
Definitely. And then we have pharmacodynamics.
Oh, yeah.
So dynamics is like, it's superpower, dynamic. It's you think of it like that.
What it does.
So that basically is how it sort of works in the body, how it exerts its actions, its powers in the body. So it focuses on receptor binding, post-receptor effects, chemical interactions, and things like that. And pharmacodynamics can actually be beneficial. If you're going to have interactions and issues, a lot of times it's more from the pharmacokinetics than the pharmacodynamics sort of effect of the drug in the body.
Makes sense.
So they're the two things we look at when we're looking at how the drug interacts in the body. Sort of fairly important.
Well, it's true. It's interesting. So and also drugs are usually detoxified by the liver, and some by the kidney, and there's some that. There's all sorts of reasons, but usually they're by the liver, and they're usually by the cytochrome P450 enzymes. There's about 20 or so. I haven't looked how many there are these days. There used to be 20. There's lots of them in there.
There's another one.
The most common one is cytochrome P450 3A4. And that's a enzyme that usually detoxifies around about 60% of drugs. So it's an enzyme that gets rid of lots of stuff. And if it's active, see, this is the problem. If you have two drugs that both go down that pathway, then they kind of like two, I was going to say fat people, that's not the polite thing, is it? But two larger men going for the door and squashing out the door, they both can't get out at the same time. So And, we've got some herbs that interact with cytochrome P450 Some speed it up, some slow it down.
That's right. So when we're talking interactions, we've got to look at when I'm sort of deciding what do I give somebody, what do I prescribe if they're on medications, is this going to increase the effects of the drug in your body or decrease the effects? Because, both ways is a problem. So if you've got a medication that you need to survive and you're putting in something that interacts and actually reduces its effect in the body, then you're in trouble.
Yeah, exactly. And just two examples on that. So let's say you're on warfarin and you have to keep clotting levels at a certain, and because you've got to remember with drugs, they're very narrow because there's a very narrow range of therapeutics. Now, I could give you turmeric and you don't have to regulate how much you eat. Typically you get it'll go through you, or it won't have an adverse effect if you have a lot of it, because, there's about 1 billion Indians that eat a lot of turmeric and, they don't have any interactions. But with drugs, they have to be kept at a certain, you got the INR, which is the level of clotting. So let's say you're on a drug that speeds up the detoxification of it, like hypericum, St. John's wort. It speeds up cytochrome P450 3A4. So you're on your warfarin and you're taking the correct doses as doctor prescribed, and it's being detoxified out of your body quickly. Everyone thinks, oh, good, it detoxes. That's good. You want to detox. You don't want to speed up detox because then your clotting factors goes up and then you get a stroke or a embolism because the drug's not working anymore because it's being detoxified. Exactly. But then again, if I decided to have a grapefruit for breakfast, then that slows down cytochrome P5304.
Yeah.
So you end up with more, and you get bleeding disorders.
Risk. Yeah, exactly.
So even harmless. Well, grapefruit. Most people don't know grapefruit.
No, grapefruit, and I mean it's probably not eaten as much as it used to, but it used to be something called the grapefruit diet.
Oh, yes.
So everyone was all over grapefruits because they're good for fat burning, but yeah, that's
because they taste like shit. No one wants to eat them.
Well, not a red grapefruit. Have you ever had a red grapefruit?
Oh, they're a bit nice. I'm not a fan of it. Yeah, I know what you mean. But people.
There's a lot of interactions with grapefruit. Yeah, with certain medications.
Because it slows down nanogen, and it slows down the detoxification. So you end up with more of the drug than you were prescribed. Yeah. And I think there's even a warning on beta blockers, which is an antihypertensive brought out about late 1960s. My father-in-law, Doug, was talking. He was working at Sydney Hospital when they came out, beta blockers.
There you go.
He was one of the first to prescribe them.
Oh, of course he was.
Yeah, back in the first. Back in 1969 was the year of my birth. Mm-hmm. And the problem with that is that if you take too much of those, and when I say take too much, you're taking the prescribed dose, 40 milligrams of propranolol, but it's not being detoxified. It builds up in your body, and your blood pressure drops too low, and you pass out in front of the steering wheel because you've low blood pressure, and you have an accident and die. Right. I mean, or you could have a dizzy spell, fall over, break your hip, because typically older people are on these things.
Yeah.
So really interesting stuff.
It's really interesting. Different
stuff.
There's a lot in it.
So the cytochrome P450s are really, really interesting.
Yeah.
And then you've got other things that with another problem is you've got absorption interference. You want to talk about that?
Yeah. So this is another problem that can happen. So how well you absorb the drugs, is there something that you're putting that slows the absorption down? So fibre supplements are really common. So people on medications and they're taking fibre supplements, maybe, for whatever reason, that can actually slow the absorption down of a lot of medications. So therefore you have that problem again. So, something as simple as psyllium husk. I have a bit of constipation, I'll just pound some psyllium. It makes me feel great. Well, if you're on medications, maybe not such a good idea. Yeah. And that's one thing that I always do suggest, even with supplements and nutrients, is to have your fibres away from your supplements and nutrients, because the same thing, it actually binds to them for one, so you're not getting the full effect. And really be careful with your fibres. A little bit is okay, but if you have quite a lot of fibres.
Well, I mean, fibre's good for us, and I, picking on you a bit here, but you have those beautiful smoothies. They're full of fibre, aren't they?
Oh, I put fibre in them.
And you're not on drugs that I know of, so only the ones that the bathroom with the white powder. No, I won't say. But we won't spread rumours.
Creatine's the only white powder.
Oh, that's right.
Really?
Yeah, that's right.
Magnesiums, you actually have a couple of white powders.
We do have a couple of white powders. You're picking up some white powder today, aren't you?
I'm picking up 2 tubs of white powder today.
2 tubs of it. Yes, fibre supplements, but also, if I say, I used to eat, LSA, linseed sunflower almond meal, super fibre, blend it up with blueberries, super fibre, blend it up and drink it and eat it with a spoon.
Yeah.
Absolutely, nothing wrong with that, completely healthy, but it could slow the absorption of drugs.
Chia seed puddings are, they're popular now. There's lots of different fibres and things that people, because everyone be bang on about fibre for your gut microbiome. But if you're on medications, just be careful about that.
Well, also you can be on certain herbs that increase the absorption of drugs, isn't there?
Yes, there are. So here's a classic one for you, ginger.
Ginger.
So that increases the gastrointestinal motility, because we give ginger a lot for digestive issues, right? So if you're if you're sort of speeding up the motility, you're actually enhancing the absorption of certain medications. Mm-hmm. So then you're getting the effects much faster, which therefore not always be a good thing either. Yeah. So it can go either way. So some can increase the absorption, some can reduce it. And something as simple as ginger that maybe someone, throws a lot. Maybe someone loves ginger, so they throw a lot in their dinner, or
Beck loves with ginger.
In their smoothie in the morning.
Can't stand it.
I love ginger.
I'm not a fan.
Oh, I like it.
I know it's good for you and shit.
I don't love the taste, but I love the action.
Oh, yeah. Okay, good.
So I deal with, I don't mind the taste, but yeah.
Oh, Beck and I stew up apples. She puts ginger in it. I can't eat it. It's like, you put this stuff in there. Look, I know it's good for you and everything. But also, just on that point about absorption, is there are drugs that are designed to be absorbed with fat.
Yes.
And a lot of people don't know. And there's a big problem with that, because migraine medication. Okay, if you get a migraine, you've got to take a migraine medication, a triptan, to squash your blood vessels so you don't get the migraine. It's very important, but they're better absorbed with fatty meals. But you can't. So sometimes the dosage will change. If you have this pill with a meal, you'll absorb more of it.
Yeah.
And if you have too much triptans, it can cause hypertension, all sorts of things. But if you have it on an empty stomach, it may not be effective.
Yeah.
So, and yet there are other drugs that are better on an empty stomach.
Yeah.
And so it's really, really interesting to be able to absorb this sort of stuff. And that's why the new triptans, like rizatriptan, is absorbed independent of fat levels. So it depends on the type of medication. The first triptan, sumatriptan, was poorly absorbed. So now they're snorting it up your nose. Prescription drug is snorted up the nose, and that gets in there faster. So it's really interesting about what you eat and all that sort of stuff.
And this should be things that your prescribing doctor actually talks to you about, all this sort of thing. So if you're getting medications off your GP and they have not even mentioning anything about interactions, how you should take that, when, where, what with, what not with, then that's a problem, because, you know, I think a lot of times people just take medications and think, oh, it's all right, the doctor hasn't said anything, it'll be fine, just take it whenever, which can be a lot of problems, obviously.
Well, the classic arthritis medication I used to take a million years ago, indomethacin, you had to have it with food. Otherwise, it'd rot your gut. So you learn quick that, but you know, it does cause. It was an old arthritis drug, and it does upset your guts dramatically. You have to have with food, and it was a pain in the butt because you'd feel all this pain coming on, and you know, I used to take 3 of them at once, and I'd just bang them down, and you know, you try and have a drink of milk or something.
You feel like doing is eating when you're in pain,
exactly. I didn't. Yeah. So, and plus it was always pain was first thing in the morning for my arthritis. I'd wake up with it. Okay. So what I'd do is I'd chew some paracetamol and codeine.
Wow.
Panadeine and it tastes the worst. Oh, geez, have you ever done that?
No, I've never done that.
It's disgusting. And because it was gentle on the stomach, you take that on an empty stomach.
Yeah.
So yeah, it is all about food now. But you know, we're talking about absorption, but also there's herbs that can alter drug transporters, because we've got drug transporters like the pea glycoproteins. You want to talk about that for a second, and how that can be changed by things like turmeric?
Yeah, turmeric. So we have transporters called pea glycoproteins, or P. So they control the movement of the drugs across the cell membranes.
Yep.
And so things that can inhibit that pea glycoprotein, things like turmeric, curcumin.
Wow.
So that increases the concentrations of drugs. So like chemotherapeutic drugs, and chemo drugs is something probably don't have a lot of people on chemo, but maybe. There's a lot of things around chemo that you shouldn't do. So that inhibits the pea glycoprotein.
Well, we could have a few people on it because there's chemo drugs that are used for different things.
Yeah, that's true, actually. Yeah, that is true. That is true. Yeah. So there's definitely issues around that. And something that can induce the pea glycoprotein, so which means that it can get them through and in and out of the cell much faster. Yep. It's St. John's wort.
Oh,
so
there's
that St. John's wort again.
I love St. John's wort, but you got to be very careful. If there's one thing you take away from today, if you're on if you're on a drug, just try and avoid it. I mean, I know there's some drugs you can take with it, and there's some that'll benefit it, but gee whiz, be very careful with that one. Really all right. So what about some of the herbs that can have I'm going to say synergistic effect. Yeah. But that can be negative and it can be positive.
It could be negative or positive, yeah. So for instance, we talk about that sort of thing. So someone's on blood thinning medication. Okay. And then they take something that can thin your blood. So
warfarin, heparin, those sort of things.
Yep. So something like ginkgo biloba.
What's that for? I forget.
It's for the brain. It's what we call a circulatory stimulant. So it's very good for blood flow, that type of thing. That can actually increase the risk of bleeding.
Wow.
So that's a synergistic effect, but in a negative way.
Yeah.
And things like garlic. That's another one. It can thin the blood. So
wow.
That one, people need to be really careful if they're on those types of medications, because garlic is very good at thinning the blood.
Well, garlic.
So it can increase the risk of bleeding and things like that. So
you can buy garlic from anywhere, supermarkets, so people are on it all the time.
Cooking.
Yeah, I do.
A lot of people load up on garlic.
Yeah, it's good. It keeps the vampires away too.
Yeah, well, I mean, like we've said, no.
I haven't got any puncture.
No, and
must work.
That's right. You eat a lot of garlic, you've never seen a vampire. Obviously.
Never.
That's right. Yeah. So, researchers all over that one.
Wow.
And then we have things called antagonistic effects.
Oh, opposite effects. Okay.
Yeah, so they have the opposite effects of some medications.
Right.
So for instance, you're on a blood pressure medication, for instance.
Yeah, let's say I am, because middle-aged men, we all are.
Yeah, there you go.
Propranolol, or say the beta blockers, or the ACE inhibitors, or
All of
the
those.
calcium channel blockers. There's billions of them. Potassium-sparing diuretics. So many antihypertensives.
So many.
Yep.
So, and there are a lot of medications that can impact this. A lot of herbs and nutrients can impact this. Ginsengs, so they can reduce the effectiveness of your blood pressure medications.
Okay.
So they have anticoagulants as well.
I've got ginseng in there.
I know which ginseng.
Panax.
Oh, Panax. Oh, you got that one.
I've got that one. Can't say the product. No, I don't want to say the product. But I've got ginseng in there, so I'm just drinking it.
Yeah, exactly.
I'm not on blood pressure medication, though, thank goodness.
Right. Or something like licorice. So the the glycerin licorice, not the DGL licorice, and you're on antihypertensives, it actually can increase your blood pressure. So therefore you're sort of counteracting what the medication is trying to do. So you've got to be really careful about those.
So that's really interesting, because blood pressure medications, everyone thinks you've got to have high blood pressure to go on them, but a lot of people are prescribing them if they've got normal blood pressure. And the reason being is because they have other side effects, and I mentioned beta blockers, so I'm just bringing that up because that's the most common one. That's used to prevent headaches and migraines. So they give that to people to prevent them getting a migraine or a headache. And their blood, just for migraines. For example, so it drops. So
they're going to have antagonistic herbs to try to make sure they don't drop their blood pressure too much.
Correct. Yeah. So and unfortunately the dose has to be pretty high.
Oh.
So it's a very common medication used to prevent migraines, but also antihistamines are used to prevent migraines. So you can be on these things and your blood pressure goes from, say, normal to low.
Yeah.
And so you're already on the low end of this. So you got to be careful that you don't sort of take something that will help enhance that, because if you have grapefruit, well, if you've got high blood pressure and it brings it back to normal, and you have grapefruit and makes it a bit lower, okay, not good. But if you're on these drugs not for blood pressure but for other things, even stress, people take beta blockers for stress.
Yeah. Well, even the amount of I see so many people in clinic that are on antihypertensives.
Oh, yeah.
And I actually have to be a little bit careful about what I give them, because and some people again self-prescribe, they jump on all the magnesium.
Oh, yeah.
All that sort of thing, taurines, and that actually drops your blood pressure. It helps to regulate your blood pressure. So I have people come back, their blood pressure's dropped too much because they're taking the magnesiums, they're taking the taurines, they're taking, even some of the herbs that are for the nervous system function actually drop your blood pressure because they're calming the nervous system. And then they're going hypotensive. So that's a really common thing.
I've got to tell you a story about my sister.
Okay.
I don't think she listens to this, but she's in Melbourne and she had high blood pressure, and she works in a doctor's surgery with 6 doctors. She's the practice manager there. She's been there for 30 years. And she said, what do I do? And I said, well, you can go to the doctors and get some scripts for antihypertensive or try magnesium. She went on magnesium, blood pressure dropped.
Yeah.
Yeah.
Yeah, well, I mean...
Back to normal.
Yeah, exactly. And to be honest, blood pressure is one of the easier, very, very easy things to regulate. So, if I come to people and say, well, I've got to, I shouldn't laugh, but I've got to go off these herbs and nutrients because my blood pressure's dropped too much. Well, would you not look at reducing the medication?
Which has side effects.
But yeah, it has the side effects. But obviously you talk to your doctor about that. But there's a lot of really easy ways to normalise your blood pressure.
Do you know what the biggest problem with beta blockers is? They cause exercise intolerance. People can't exercise. Yeah. They can't get their heart rate up because it blocks it.
Yeah.
And therefore they go to push themselves, and normally the heart responds and pumps the blood around. That doesn't, because it's blocked. And they go, oh, I can't exercise. I feel like crap, and you feel awful.
Oh, I've seen quite a few clients recently that have had severe issues with that, even to the point of being able to get up and move around and function during the day. They can't, because they can't breathe. They're breathless. They're shaky. Because you can't get your heart rate up. And a couple of them, I explained it, and they said, I never knew that.
Wow.
I'm never told what the actual drug's doing.
And here's a shock horror thing. Cardiovascular exercise is good for the cardiovascular system.
That's right.
And so you should be doing exercise if you've got blood pressure issues or cardiovascular issues in all the moderation stuff.
Be clean with the GP first.
Yeah, of course. But it's very good for you.
Yeah.
And so to stop, it's so reducing those drugs, of course I'm biased towards natural medicines, but if you can get off the side effects of these drugs, you're going to be way better off. Because, if I overdose on magnesium, the worst thing that'll happen is I'll get diarrhea.
Yeah.
If I take the wrong sort, too much of it. But, it doesn't cause your blood pressure to drop through and doesn't cause exercise. In fact, you exercise better when you got loads of magnesium.
That's right.
Interesting.
Yeah.
And if you want to test magnesium, don't get a serum magnesium, get a red blood cell magnesium test.
Yes.
And try and make sure it's above 6.
Yes. Yeah.
Sorry, just to go a little bit off topic there.
Blood test people.
All right, now we can also alter how our drugs are excreted.
Yes. So
tell us about that.
They can impact the excretion of drugs through the kidneys.
Yep.
So either they accumulate or they clear much faster.
Yep.
So diuretic type herbs.
Okay.
So dandelion leaf that can increase the excretion of certain drugs because it's a diuretic.
And
so you've got to be careful about that.
Lithium is one of them.
Yeah, lithium.
Now lithium's a scary one because that's used to treat bipolar. They usually get about 300 milligrams. So if you're altering the amount of lithium in your body, then you can literally get issues in your bipolar. Could come back if you're excreting it too fast.
Yeah. Definitely.
So it's scary. Now, lithium's a mineral too. It's on the periodic table. It's number 3.
Yeah.
So it used to be in vitamins and minerals in the olden days. Do you remember the old Tressos bee?
Yes, I do remember.
That had lithium in it.
I didn't know it had lithium in it.
You can still buy lithium up to 5 milligrams in America at Walmart.
That doesn't surprise me. You can get anything in America.
But it's very good for your brain. It's just that the dosages are very different.
Yeah.
Lithium is needed for the brain. It's good to prevent Alzheimer's too. Lithium. Very good for your depression and everything too.
There you go.
So very good. So you can actually take dandelion root tea, and you can get that as a tea, and roots do help with diuresis too. But
they do, yeah. So dandelion leaves are really good. But there's so many diuretic herbs.
Oh yeah,
cleavers. There's so many corn silk. I could go on. There's loads.
Yeah, there are.
Them. So you want to be a bit careful about that.
Juniper berries are the ones that we used to give for diuresis.
Ah, right. Yeah, juniper berry. Okay, well, here's one that maybe it's probably not one of the most common ones, but it is used a lot, is alpha-lipoic acid, and we've talked about that. It's an antioxidant.
Great antioxidant.
Very good
gets into your brain, gets rid of heavy metals. Good. Great for diabetics, all sorts of stuff.
Blood sugar regulation, things like that. So if you're on any on hypoglycemic drugs to help to regulate your blood sugars.
Metformins
and things like that. And this is quite common. Alpha-lipoic acid is not a good one because it actually drops your blood sugars too much. So that's and I do see that quite a lot, and particularly now Ozempics. Now that people are on the semaglutide medications, I have seen quite a few clients that are on those. And they're taking things for their blood sugar because they're like, I'm getting my blood sugar down, my insulin's too high, that sort of thing. And they're they're getting dizzy. Yeah. They're I'm faint, I need to sit down. Their blood sugars are dropping too much. So alpha-lipoic acid, berberine is another one that I see all the time. There's so many, chromium, there's loads. So you've got to be really careful when you're on these medications.
It's just quite funny with diabetes. It's another one that I think is undertreated by people like us because I think we can treat it quite effectively.
Type 1 or type 2?
2.
Type 2, yeah.
Which is the adult onset,
It's I don't say very easy. It is quite easy to treat.
Yeah, and the problem I see with type 2 diabetics, and I'm going to be very stereotypical here, is they're often overweight, they often don't eat well, and they often don't exercise.
Yeah.
Let's change those 3 parameters, which are intimately changeable. They can exercise, they can lose weight, they can eat better. It usually reverses most two type 2 diabetes.
Yeah.
So I know it's a controversial thing to say, but the studies are clear on this.
Yeah.
And what happened with type 2, which is about 95% of diabetes, it's most of them is type 2, is that they'll chase the drug because typically those people have had they're typically my age or older, and they're typically stuck in their ways, and they and I've got a family member who said this, and who asked me about their type 2 diabetes because they've got type 2 diabetes. I'll tell you after the podcast who it is.
Okay.
And I said, well, why don't you just start exercising and cut out the sugars and take it from there? Oh, geez whiz. But what can I take?
Yeah.
And it's like, take a walk.
Yeah. Well, that's really take a walk. Exactly.
Take a bit of cement and harden up so you can stop eating Tim Tams for morning tea, which is what they did.
Yeah. And then so many people on the semaglutide medications, Ozempics and things, because they want the they want the easy route. I'm going to upset a lot of people, I know.
I've
but
upset
look,
them.
that's just the fact. I mean, I see them in clinic. So, and a lot of these people don't exercise much or they don't have time to exercise, and you break down their day and they might have 3 hours in the morning and 4 hours in the evening. But, and that's why there's so much more issues. There's so many, people on medications, therefore it's creating side effects and other conditions. And I think a lot of times this is going a bit off track, but I like to have little rants here and there.
Go rant.
Everything's becoming so complicated. Like weight loss, everything is like you've got to do your stress management. So you've got to do your cold plunges and you've got to do this and you've got to do your 5 minutes of meditation and then you've got to do this with your food. And it's like everything has become so complicated because it's, everyone wants to do the hacks and the biohacking and that.
Oh, the hack. I hate that word. How do you hack diabetes? How about you just do what's worked for us?
What happened to the basics? The basics are there for a reason and they work. So just get up and move. Yeah. Just eat better and, just have time, some downtime. That basic things. But anyway, I don't know how we got off track. But
no, it's good. I like the rants because you need to get that message across. We're talking about
people on these medications and these Ozempics and things some have horrendous long-term, can have long-term.
I've got two family members and friends that are on Ozempic. I don't know if they still are. And they said, it just helps me stop eating junk food. It's like, who else can stop you eating junk food? You can, because you don't have to buy it.
Yeah.
Just don't eat it.
Yeah. But there is no magic bullet, Steve.
No magic bullet, Steve. No silver bullet either.
No silver bullet
Gold bullets, nothing.
No, that bit's cut out. Don't know what we're talking about.
Maybe still in there. Maybe in the blooper.
No, I won't leave it in there. There is no magic bullet. And it all comes back to the basics.
Of course.
There is no way of hacking around, biohacking around it.
Biohacking, I hate that word.
So alpha lipoic acid and other blood sugar regulating herbs and supplements. Be really careful if you're on these hypoglycemic drugs.
That's good. I'll give you one.
Yeah.
What about if you're on methotrexate for your arthritis? Okay?
Yeah.
Methotrexate is an immunosuppressant. It used to be a chemotherapeutic drug, so it targets rapidly dividing cells, such as immune cells. And let's say I get a cold or flu, because I probably would if I'm on immunosuppressant drugs, and I take Andrographis or Echinacea or any of those immune-boosting herbs, you're actually counteracting the immune suppression. So that's what they call a theoretical contraindication.
Yes.
I like that. So you can actually, you got to be a bit careful about taking immune boosting stuff while you're on immunosuppressant stuff.
Yes.
You'd see that dichotomy there. So one of them will win out, and I don't know which one.
It's interesting because, there's so many people that have autoimmune conditions now.
Yes.
And they're told to not take any immune stimulating herbs, but that's not entirely true.
No.
But with immune suppressing drugs, 100%, you've got to be careful because if you're on it for a reason. But yes, if you're on, if you just have an autoimmune condition, then a lot of these immune modulating and enhancing herbs actually can be quite good.
Yeah.
So, but not if you're on a
I mean, they're like sulfasalazine, which is my immunosuppressant that I was on 1 billion years ago, that destroys folate.
Yes.
So one of the things you need to take with that is, and I was even told this by the doctor, was folic acid.
Yes.
I don't think folic acid is the right one to take, but it was folate.
I always prescribe folate if somebody's on methotrexate.
Yeah. And sulfasalazine, which is another drug for you. But you got one there? Want to read one out?
What about ashwagandha? I mean, that's the classic, right? We
love that herb.
Boosts
my testosterone levels.
That's right. Yeah, it's very, very good. It's good for thyroid function.
Good for thyroid function.
For the nervous system. It's good for everything. So if you're on benzodiazepines.
Sleeping tablets or anti-sedative,
diazepams and things. So that can actually increase the drug effect. So you want to be careful about that. Yeah, so it has GABAergic qualities.
GABA-aminobutyric acid, which is the target receptor for the benzodiazepine. So anything with a PAM at the end of it.
Yes.
Lorazepam, diazepam. That's the Valium. Temazepam. Any of those.
Any of those PAMs.
PAMs.
Watch out for the PAMs.
Watch out for PAMs in this world. We're going to get upset we're going to upset the PAMs in the world, aren't we?
So that you've got to be a bit careful. Hypoglycemic drugs as well. So that might again increase the effect.
Yep.
And also, so we have indications. We have things that have a very high possibility. Then we have a moderate possibility of causing interactions. Yep. So thyroid hormone. So if you're on a if you have hyperthyroidism,
Yep.
then be careful with ashwagandha because it actually can increase your TSH and cause your
which is normally a good thing.
Which is a good thing. So if you have underactive thyroid, it can work well. So be a little bit cautious if you're on medications for hyperthyroidism or Graves. So even things like ashwagandha can have contraindications with some things. So you
Wow.
be a little bit careful.
All right. Okay. I was going to do. I'll skip my ashwagandha one.
Okay. Oh, sorry.
No, you didn't.
We're
That's
both
right.
on the A's.
Okay. Let's say I've got arthritis because I have. Well, I'm supposed to have, and I'm on. Like I have boswellia, which is a great herb. But if you're on warfarin, there's a contraindication of that because it changes your INR, which is your concentration. It has been found in 2 cases to change your clotting effects. So, don't take warfarin and boswellia. You have to monitor closely. So be very careful of that one. Yeah. You got one for it?
Yep. Let me have a look here. Oh, here's one for you, Steve. Hang on. We're going to have to skip through some of these.
I know. We'll go through them pretty quick.
Calcium.
What's wrong with calcium?
So a lot of people are on calcium supplements, right?
Of course.
Yeah, so that can be. So corticosteroids. So corticosteroids may reduce the intestinal absorption of calcium and increase renal calcium excretion, leading to hypoglycemia, Steve. That's a very high, it could be a fairly high contraindication. And then antiretroviral medications.
Right, so that's for things like HIV or any of those sort of, viruses,
Yep. That can decrease the drug effect if you're having calcium.
Wow.
So you want to be a little bit
calcium.
careful. Calcium, yeah.
So let's expand that out to a large glass of milk.
Yes.
I mean, I know we're getting to foods later, but that's milk.
Yeah.
And that can screw with things like,
hang in there because we've got a few foods as well that
we've got
to be
foods.
careful of, just general foods.
We won't go into foods yet. We will later, yeah.
A bit later, not just
all right, now you and I love this herb, cat's claw.
I love cat's claw. It's one of my favourites.
Because we were talking about getting a bottle of it and that sort of thing.
Yes.
But what if you're on immunosuppressant medication? Contraindicated, definitely. Yes. But also, what if you're on a Parkinson's medication like levodopa? Contraindicated. It impairs the absorption of the drug or the amino acid, levodopa.
Wow.
Interesting, eh?
That is really interesting, yeah. So here's one that a lot of people use, Steve.
What's that?
Fish oils.
Oh, hang on. Fish oils, yeah?
Yeah, so really common. A lot of people on fish oils, right?
I take fish oils. What am I not allowed to take with it?
Well, if you're on anticoagulant or an antiplatelet medications, then it actually can increase the drug
effectiveness, yeah.
So therefore you can have sort of bleeding and just issues and things like that. So you've got to be really careful with that.
And I hate to go off topic again a little bit, but if you have a lot of fish, cold water fish, like lots of salmon. The wife loves salmon. I'm too cheap to buy for her, but no, I do.
You know what? Salmon that now, and this isn't even wild caught because you can't get wild caught. You can't get Australian. I've got pulled up what somebody said once. You can get wild caught in Australia, but it's not Australian fish. You can't get it caught in Australia. You can get it from flown in from overseas. But it's $100 a kilo at the moment, salmon. Farm salmon. That's right. No one can. Who can afford that?
Not
I used to eat a lot of salmon. I don't eat as much now.
Bugger that.
Anyway, we digress. And chemotherapy drugs as well.
That's
another one. So anything, so that can decrease the drug effect. Right. So you want to be a little bit careful about that. But and then antihypertensive drugs. Some people, there is a moderate interaction there, so it can reduce obviously your blood pressure a little bit.
Yep.
So you've got to be a little bit careful with that.
All right.
That's just
Have you ever had a nice chamomile tea, Nick?
I have had a nice chamomile tea.
Well, I hope you're not taking. Not if you're on warfarin, you shouldn't.
Oh.
It potentiates the effects of warfarin, so you get more bleeding.
Ah, there you go. Wow. Interesting. Here's one for you, Steve.
What's that one?
Well, we talked about folic acid, but there's quite a lot of interactions with folic acid. Well, what about this flaxseed oil?
Flaxseed oil? Oh, come on.
A lot of it vegans and plant-based, people on plant-based. But if you're on an antihypertensive drug, Steve, there's a moderate to high risk of that it increases the drug impact. Therefore, you're going to drop your blood pressure too much. So you've got to be a little bit careful about that. Anticoagulant and antiplatelet agents again.
Yep.
Got to be careful about that. So that's flaxseed oil, plain old flaxseed oil.
Jeez.
No.
Okay, I'm going to give you a real common herb, Echinacea. Everyone takes Echinacea, right?
Yes.
Either the purpurea or angustifolia.
Yes.
Have you ever had how do I put this politely? For people listening, not you, I won't, not you, but ever had a camera put up your butt to look for polyps and all that sort of,
I've never had a camera up my butt.
Okay. So there was a colonoscopy, which a staff member here, I won't mention their name because I don't even want to give the sex away.
Oh, they don't listen to the podcast anyway.
They don't, okay. So they were telling me they had one the other day, so it made me think of that. So one of the drugs they give you with that is they mildly sedate you, you're kind of out of it a bit. They give you fentanyl or midazolam. Now, guess what? Echinacea interferes madly with midazolam.
Does it? Okay.
Yeah, so you've got problems that it decreases the drug levels when administered intravenously. So there's been a clinical trial on this. So if you want to be out of it for your camera, your photo shoot.
Hope to be,
is that the photo shoot? Can I call it that? Is that the polite way of?
I guess so.
That's all right, is it? Okay, so let's say you've had your Echinacea because it's winter or whatever the hell, and you're having midazolam, it's not effective. It's getting detoxified quickly.
So you're going to be awake pretty much
for the photo shoot. You don't want to be awake for that photo shoot.
You don't want to be awake for that.
No. So that's an interesting one anyway.
Wow. Okay.
Wow.
Hawthorn.
Yes.
So a lot of people have cardio. It's very good for
really
cardiovascular
good for blood
health,
pressures
for heart,
and
that sort of thing. And I guess a lot of people, they're on medications, they have heart issues, and they're like,
Sure.
well, what else can I do? I'm going to Google something. Oh, Hawthorn's great. I'm going to grab some Hawthorn.
Yep.
So if you're on antihypertensive drugs,
no.
if you're on nitrates,
Yep.
anticoagulant, antiplatelet drugs,
Yep, I'm all of those for my heart problem.
if you're on phosphodiesterase 5 inhibitors, Steve.
Yeah, I could
we
be
don't
on
know.
those. I'm old enough to be on those. We better say they're the erection drugs.
Yes, they're the erection drugs.
PDE5 inhibitors, we call them.
Yeah, that's right. So they could have additive effects on most of those drugs.
It
Could make it worse. I don't know.
worse or better.
Well, it depends really on which way you're going to look at it. When I was,
Do you ever take an evening primrose oil?
I haven't.
Oh, really? I thought, you've been
Why,
a woman
Steve?
for...
Why do you think I would take it?
Well, just in case you
Because I'm
may...
of a certain age?
Yeah, just if you... Well, no, just a certain age, but, it's good for PMS and all sorts of stuff.
I never really have.
You never have that?
Little bit.
Angel. But if you're on lithium because you're bipolar, you'd be in big trouble.
There might be a few women that might turn bipolar.
It literally changes the dose level of lithium in your body.
There you go.
It may reduce the serum levels. What about this one? I'll give you one, just while you're looking one up.
Yeah.
Ginger.
Ginger, yeah.
Don't take antacid with ginger because they actually counteract each other.
There you go.
Simple one, isn't it? But people don't think
Isn't
of
that funny? Because you're taking an antacid because you obviously got acid reflux, things like that.
Yep.
And then what's ginger really good for? Acids and things
reflux.
like that. So I'll just chuck a bit of ginger in there as well.
God.
So magnesium, Steve.
Oh, come on. I've got magnesium in there too. What am I going to be interacting with my drugs now? Not Viagra again, is it?
Not Viagra again.
Good.
So antiarrhythmic drugs.
Ooh.
Yeah.
Now that's interesting.
Yeah.
That is really interesting.
That is interesting, yeah.
Because magnesium is used for...
Yeah.
Okay, tell us, sorry.
Yeah, because it's very common now. It's becoming more common in men. But yes, magnesium is very good for that. But if
Really
you're on
good.
an antiarrhythmia drug, then there could be some pretty strong contraindications with magnesium.
Well, also, when you've got, we'll just call it AF.
Yes, AF is much better, thank you.
Atrial fibrillation is you often are on anticoagulants too.
Yeah, yes. So
clots.
that is another medication that you've got to be careful of with magnesium. Antihypertensive because, again, as I said, and look, you're not going to keel over and die, but you can drop your blood pressure too much with the magnesiums. So there's a lot with magnesium. There's some other ones. So there is HMG-CoA reductase inhibitors.
Statin drugs, yep. Levodopa, which is for Parkinson's,
Yep, so that can decrease the effect as well. So there's quite a lot for magnesium. I think there's another page of it. There is another page of it. But yeah, quite a few medications.
Oh, yeah, absolutely.
So be careful. Low dose medication, I think, would be okay.
Yeah.
But just be careful with your dose of magnesiums.
All right. What if you ever had any green tea, Nic?
I have had green tea, yes.
Well, don't have it if you're on aspirin or warfarin because it may potentiate bleeding.
Oh, so
Green tea has a massive amount of drugs.
Green tea has a massive amount of drugs?
It has a massive amount of interactions, green tea. Oh, absolutely.
does it?
Oh, absolutely. There's heaps of them, even Viagra. But it's not a bad one. It's actually increases the bioavailability of that one. It's a definite. So, but good old Midazolam again, and it decreases folate absorption. So it decreases digoxin, which is a heart drug. So it's got quite a few things. So if you're taking green tea regularly, then talk to your doctor about it if you're on medication.
Yeah, definitely. Aloe vera. That's a big no-no.
Come on, aloe vera.
Yeah. So our long-term aloe vera use may lower potassium levels.
Ooh.
Yeah. It has a laxative effect, so therefore you're getting the drug.
Yeah.
So that one's a big one. Licorice root, so non-deglycerized licorice, obviously, with the blood pressure.
Yep.
So that one, big no-no. St. John's wort. It's always in there, isn't it?
Every drug is affected by St. John's wort.
Yeah. And then there's some warnings. So things that are, just be careful, monitor any symptoms and things that come along with it. Calcium, ginkgo, peppermint oil, potassium, vitamin 3. So niacin. They're ones to just be
B3,
be careful
niacin.
of.
Yeah.
What did I say?
You said 3, I think. I don't know if
Vitamin 3. Did I say vitamin 3? B3, niacin.
Could have been D3.
Could have been D3. So niacin, yeah. So there's some things to be a little bit.
Niacin. The form of nicotinic acid is a vasodilator, so that can change your blood pressure dramatically.
Yeah, and then things that these medications can actually deplete. So it can deplete your folate levels.
Yes.
Magnesium due to the diuretics.
Yes.
Potassium due to the diuretics.
Yep.
Vitamin B1.
Yep.
From loop diuretics.
Wow.
B6.
Yep.
Vitamin C.
Yep.
Zinc.
Yep.
So they're things that you can become depleted in if you're on these antihypertensive
Well, I know
medications.
the old diuretics used to deplete potassium dramatically until they came up with potassium sparing diuretics.
Yeah.
Surprise, surprise.
Exactly.
And also calcium channel blockers block the effects of calcium. Literally, that's what they're called.
Yeah.
So
It's all
quite
in the
scary.
title.
So with antihypertensive, a lot of people are on statin drugs. And our mate herb, our great herb, St. John's wort, has been clinically shown to disrupt the levels of it and screw with it badly. Like it just detoxifies them out of the body system.
Yeah.
And you don't want them, if you're taking them for a reason, you don't want them detoxified.
You don't want them detoxified.
So good old St. John's wort's good. And we're picking on it today, but we could do a podcast on St. John's wort and show you how bloody good it is.
Well, I know. It's amazing, isn't it? Yeah.
Depression, viruses, everything.
Yeah. So, St. John's wort. And then depletions, when you're looking at your statins, cholesterol-lowering medications and things, iron can be depleted, vitamin A, B2, B3, B12, vitamin E, vitamin D, vitamin K, zinc. Can get quite a lot of depletions from these things.
And what about ubiquinol?
Well, CoQ10, 100%. That's just a standard.
Stops making it.
Stops making it. So people that get they're on statins and they get the muscle pain and the cramping and all that sort of thing can be CoQ10 deficiency. So always. And I have had so many clients that I say, "Oh, let's put you on CoQ10," as your doctor mentioned that. Never mentioned it.
No.
Never heard that before.
Jeez.
Doctors don't tell them.
My mother had a heart attack about 10 years ago. And she was put on statins and she didn't want to take them, but I gave her CoQ10. She goes, "Should I ask your doctor about it?" I said, "If you want." But I just go because she's my mother.
Yeah.
I just said, "No, you got to take them." And she went and asked the doctor, said, "Oh, yeah, great idea." The cardiologist. So luckily I got the tick for that. But even if I didn't get the tick with it, I don't want to sound like an egotistical person, but I would have given it to her anyway.
Yeah, well, I always do. If people come to me on statins, I always prescribe CoQ10 alongside it. You don't need to ask, to talk to a professional.
Yep, always.
Don't just self-prescribe. But yeah, definitely that's a big one. So
I mean, there's a lot to this. There's so many. I mean,
we could go on and on and on. There's just so many interactions, so many drugs. So I think we're trying to highlight. Be really careful if you're on any prescribed medications.
Yeah.
If you don't self-prescribe nutrients and herbs because there could be a lot of contraindications. And also, Steve, be careful what you eat.
Oh, come on. Surely I can eat anything I want. What about, can I still have my morning coffee?
Well, there are quite a few things you need to be careful of if you're having coffee and you're on medications.
Joking, really?
So there's a lot of studies that show that consumption of coffee along with particular foods.
Because everyone drinks coffee.
Well, we don't.
Yeah, I don't, but...
No, we don't drink coffee.
Yuck.
No, I'm not a coffee drinker. It can affect the absorption, distribution, metabolism and excretion of a lot of drugs.
Oh, God. What's the first drug?
Okay, so let me see. Midazolam.
Oh, great. So you can't, go into an anaesthetic and you can't. No. Oh, damn.
Yeah. So that can decrease the absorption of it.
Wow.
Yeah.
There you go.
Aspirin, it can increase the absorption of it.
Wow.
So say here's something for you. Say you've been off coffee for like 3 or 4 days and you've got a headache, because that can happen.
Yeah.
You're like, oh, damn it, I can't deal with it anymore. I can't deal with this headache. I'm just going to have an aspirin and I'll just have a coffee and that'll get rid of it. So then you're going to increase the absorption of your aspirin. So you want to be careful about that.
Yeah, that's kidney toxic.
There's vitamin D and calcium.
Whoa.
Can decrease the absorption.
Yep.
Levodopa increases the distribution of the drug.
So they can make it more potent.
Yeah, there's loads. Lithium, warfarin. There's loads of them there. There's loads. So you really be really careful with your morning coffee.
Wow.
Medications.
It can decrease calcium and vitamin D as well. I know it's not a drug, but
exactly.
That's nuts, isn't it?
It's nuts. Yeah. Here's something that's really common.
Oh, what is it?
Antibiotics.
Oh no.
I mean, how many people get antibiotics?
Okay.
I think we touched on that before.
We did.
Dairy. Don't have dairy with your antibiotics.
It's high calcium.
Because it can bind to it and affect its absorption. So therefore you're not getting the full therapeutic amount of it. Therefore you can build up
resistant microbes.
Very much resistance to it.
Yeah.
Because you say you've got to take the full.
Yeah, of course, full dose, and
you're not getting the absorption of it. So you need to wait 2 hours 2 hours before or 6 hours after your antibiotics if you're having dairy.
Wow. So a lot, and I'm going to give you a scenario here. So the good old morning wheat bix, people take their antibiotics with that, they're in trouble.
Yeah.
Wow.
Be careful of that.
And also, I'll be melodramatic here, but you might be on antibiotic for a severe kidney infection.
Yeah.
And if you're not taking it or, not absorbing it, then you're in big trouble.
You are in big trouble.
That is scary stuff.
Yeah. What about this one? Monoamine inhibitors, Steve.
MAOs, which are used for depression.
Yeah. Aged cheeses or any tyramine foods.
Tyramine's in wine and cheese, yeah.
All those sorts of things.
Oh, my
can
God.
Cause a hypertensive effect.
Oh, my God.
Lowers your blood pressure.
Jeez.
So,
what other bad news?
Hypertensive effect.
What other bad news have you got for me there?
So hypothyroid drugs with any food at all. I think most people are on drugs for thyroid or any thyroid medication,
Yep.
They'd probably know to not eat with the medication.
Okay.
But don't. Because it affects the absorption. You have to have your thyroid medication on an empty stomach.
There you go.
Yeah.
Wow.
Spironolactone.
It's a nice diuretic.
So licorice, as we said, we can increase that as well.
Jeez.
The antipsychotic medication, Risodone.
Yep.
Small meals, Steve. Small meals. So you have to have it with a meal with at least 500 calories.
So that's a bit specific, isn't it?
Yeah. Otherwise, it helps the effect of the drug. If you have a smaller meal, it can.
But I can certainly have a wine and a few beers with my SSRIs coming.
Okay. Now this one is so common. So common. I'm banging on the table when we come through because I see it all the time. People are
bang the table, Nick.
No, I'm not going to do it. People on SSRIs, they have alcohol.
Like this is the Prozacs and those sort of things.
Yeah, I have people that I know that do it. And I'm like, do not have alcohol.
Really?
Yeah. So it can increase gastrointestinal bleeding.
Yeah.
So don't do it, people.
Drinking alcohol is a shocker, especially if you've got mental health issues. And yet you're on, fluoxetine or Prozac for mental health issues.
Yeah, exactly.
It's kind of like it's a little bit like you shouldn't be doing it anyway, but if you do, you're in big trouble.
Yeah.
It's amazing, isn't it?
It's terrible. And then antifungals and things like that.
Like Flagyl?
Yeah, that can all be part of it. So alcohol again, do not drink alcohol. It interferes with the alcohol metabolism, so it can cause severe vomiting and things like that.
Oh, my God.
So not only have to be careful about what you're taking, self-prescribing is in supplements and herbs, you've also got to be careful about what you eat, when you eat, too much fibre, don't have too much fibre if you're having your medications, don't space it out.
Yep.
Generally, I usually say if I'm prescribing and they're on a medication, have it a couple hours apart, depending on the half-life of the drug, which is why we need to know what drug they're on. But you want to space it apart if there are some.
God.
And we didn't mention there are drug-to-drug interactions as well.
Oh, we haven't even gone there.
And we won't go there because it's too hard, too in-depth. But
huge.
I mean, I have clients that come to me, they're on different medications, they don't interact. And a lot of the problem is a doctor will put them on a medication and then they might go see a different doctor and I'll put you on this medication. They don't cross-check what the other person or what they're on already. They should, they don't. But I see it a lot of the time. Or there is interactions and the doctor's going to be fine. So that's something. And then another thing that I get is that people come into clinic and they're having all these symptoms, side effects, or these things that are going on there, like side effects. And I look at the medications they're on and they're all from the medications.
Oh, yeah.
So then you need to explain, well, it's from the medications. We can maybe counter some of it, but a lot of it is from the medication. So you have to distinguish if you started to having sort of symptoms and things that only come on since you've had medications. Have a look at the medications and see whether that could be a contributing factor or the cause of. So there's some things you've got to be really careful of.
This is scary stuff. And so the big take-home message, and I'll say it again, is check with your GP when you're prescribe medicines. Talk to them about herb-drug interactions and nutrient-drug interactions, even simple things like drinking milk with your antibiotics, or this is scary stuff. So be aware of all this sort of stuff, especially if you're on any sort of medication you're taking long term. Yeah,
and medications aren't benign.
No.
And, supplement herbs and things aren't benign as well. People think, because the doctor throws them at you, like, well, there's a lot of them. They're fine. Yeah. There is dangers involved in that sort of thing. So you have to be really careful.
Yeah.
So, and because I see that a lot in clinic that people do just self-prescribe, just stop doing that. Just be careful.
Nic, it's scary stuff, but check with your GP again, check with your doctor, check with your specialist. If you're seeing a specialist, they're pretty switched on with this sort of stuff too.
And don't go off any medications because you're on supplements.
Don't change.
Don't talk to your GP.
Talk to your GP. Great. Yeah. Nic, this is amazing. Well, this has been fun today. I've learned a lot. You've come up with stuff I'd never heard of. And I'm a nerd.
There's so much out there.
It's crazy.
Like I said, we haven't even gotten through half the list.
No,
we just would do here for hours. But we just wanted to highlight, just be careful. There can be a lot of interactions with common amazing herbs and nutrients.
Yeah, and these things, medicines have their use, herbs have their use. So,
totally.
So, wow, amazing. Well, they've got to live in harmony.
That's right, Steve.
That's right. That's a good take, the harmony ending.
Yes.
All right, Nic, thanks for that. Right. Well, I'll see you next week.
Yeah, see you guys.
Bye.
Bye. FAQ, Steve.
What's an FAQ?
So we've got FAQs. So some people maybe don't know what FAQs are because they might not have been around when listened to years ago when the podcast started. We used to do FAQs all the time, which are frequently asked questions.
Ah, yes.
So after an episode, we would get people that would write in with a question.
Yep.
And we would answer it. As two naturopaths, we would answer your questions.
Yep.
So if you do have a question, I think there's a link if you're watching on the YouTube below that you can send your question to. You can put it in the comments.
You can look up our website.
You can put it in and we'll answer your question for you as best we can. We obviously can't give full medical advice, but we can give you some direction.
Yeah, sure.
And we can't really recommend products as such either. So, but we can give you some direction to go in.
Excellent. Well, can I ask you an FAQ?
Sure.
This is from Anonymous.
Okay.
So, I've been experiencing ongoing skin rashes, fatigue, brain fog and anxiety for a few years now, and doctors don't know what it is. They have put me on different medications, but nothing has helped much. I really want to get to the bottom of this, what is causing the issues, rather than keep trying different medications. Where do I start? Because that's a vague skin rash, fatigue, brain fog, anxiety. Where do they start?
That's pretty broad, isn't it?
Oh,
but,
glad you got it, not me.
I see people come into the clinic all the time with lots of different symptoms, and they've been to see doctors and practitioners, and no one can really figure out what it is. So, it could be lots of different things. But if I take a bit of a broad approach to it and I look at skin rashes, fatigue, brain fog, anxiety, first question would be, have you been exposed to mold?
No,
because
mold,
it sounds like it's a possibility there could be a mold infection can cause a lot of these, particularly the skin rashes, or the brain fog, the anxiety. So that's sort of that the histamine release and that sort of thing from the mold infection. So mold infection can be very insidious, and there are a lot of different symptoms that can be pretty vague and broad. So it can be quite hard to diagnose what it is. But if you've been exposed to mold, you've lived in a moldy environment, things like that, you don't even have to see mold. You can smell it sometimes.
Yeah.
I can walk into a place and know if there's mold there straight up because my nose starts to burn. But that could be something. So maybe look into that. And if you do have a mold infection, you really need to get in and detoxify and get into the antifungals, either herbs and things like that. But have some mycotoxin testing done.
Yes.
That can tell you whether you have mold, high levels of mold in your body. So that could be somewhere to start. If you've tried every other avenue and not got anywhere, try that anonymous and see if that gets you on track.
And would you recommend an oat here?
I would recommend an oat, an organic acid test, definitely, because you can do oat or you can do a mycotoxin testing.
Yeah.
Organic acid testing can be a good start because you're looking at all the different systems and seeing where there might be imbalances, blockages, the cycles aren't working properly, citric acid cycles and things like that.
Yep.
Whereas a mycotoxin testing is testing purely for mycotoxins or molds.
Okay. Gotcha.
So organic acid testing, yes, a really great place to start. And even if it's not mold, you can still get indications of maybe other imbalances in other systems. So oats are great for that.
Excellent.
Yeah. All right, I'll read you this one.
You give me one.
This one's from Brett.
Hey, Brett.
So I had food poisoning 2 years ago, and ever since then I've had issues with bloating, constipation and gas. I've tried lots of different gut products, but nothing has worked for very long. Any suggestions of what I can do?
Really interesting. Okay, so we're thinking infectious because 2 years ago food poisoning.
Yeah.
And bloating usually is in the small intestine because if you get bloating in the large intestine, you fart it out.
Yes.
Because that's at the end of the process.
That's right.
So you got about 30 feet of this small intestine in here and you can get an overgrowth of bad bacteria, which is probably from the food poisoning. So it could be a Methanobrevibacter, which is a type of bacteria which causes gas. Methano means it's a methionine producing or methyl producing, so it produces methane gas. So certainly there's certain things you can do to test for that. So a good stool test would be the first place to start. And I'd test that to see what's going on in the small intestine there. And you can certainly take, a polyphenol-rich diet, which can help with that too, the overgrowth. There's other things you can try, but I would certainly start with the stool test to find out what's really going on, then we can target it.
And even breath testing to do this.
Oh, hydrogen breath test. Yeah, of course. That'd be good too.
Do both of those definitely.
Yeah. And before you go into endoscopes and all that sort of stuff.
Oh, yeah. And I get a lot of people who do endoscopies, colonoscopies, things like that. And I'm like, well, that's not really looking far enough in. So they always come back clear a lot of the time. Like, you're not really looking. And when you're not looking at the microbiome either, so you're not getting in far enough. So they're good for polyps and things like that. So
that's a good one.
Yeah, come on, Steve.
Oh, let's start with that. Now, I've got one for you.
Okay.
It's from Amanda. Any suggestions to reduce hot flushes? I'm suffering with them throughout the day. What can I do to stop them? Simple question. What's that? Well, it's a short question. I won't say simple, but it's tricky, isn't it?
Well, I think it's relatively simple, actually. And I have my own theory on this, and I'm sure it's not really my own theory, but, well, maybe.
Okay.
Hot flushes, I don't believe it's hormone related.
What do you
everyone's
believe?
like, you go through menopause and it's a drop in estrogen.
Yep.
And yes, in a roundabout way, but it's blood sugar.
Right.
So it's blood sugar dysregulation. As soon as your blood sugar, goes up or down, you flush.
Yes.
So that's where the flushing comes in.
Right.
And people say, well, yeah, but you put on HRT and they go away. Yes, because estrogen helps with blood sugar, insulin sensitivity.
It does help.
So you lose your estrogen, you become less insulin sensitive.
Yep.
You have more blood sugar dysregulation. When you're losing those hormones, you're losing that protective effect on the nervous system. So to help with that, so that stress then impacts blood sugar as well. So make sure you're doing a really balanced diet.
Wow.
Get your sugars out, get your refined carbohydrates out, get a really metabolically balanced meal, so your protein and some fats in there. Regulate your blood sugar throughout the day, manage your stress, manage your sleep as well. And you'll find the hot flushes should reduce. You can do things like berberine, if you're not on any medications, can be good for blood sugar regulation, very good for menopausal women, that sort of thing. And there's other things, inositol, apple cider vinegars, walking after meals or exercising after meals and things like that. But yeah, it's a blood sugar dysregulation issue with the hot flushes.
That's fascinating.
So yeah, manage your blood sugars or balance your blood sugars and you should reduce your flushes or get rid of them.
That's great.
And the reason I say this is because I'm on this train.
Yeah.
If it was purely just from lack of hormones, every single woman that ever goes through menopause would have flushes, and they don't.
That's true.
So it's not just the drop in hormones. The drop in hormones creates the imbalance, and then if your lifestyle isn't spot on with diet and that sort of stuff, and you're having sugars and not the best foods, you will have the flushes. So
Excellent.
balance your blood sugar. There you go, Amanda. Happy that.
Amazing. Well, that's great, Nic. Well, that's about all we've got time for, so we'll see you all next week.
Yeah. Dear.
Uh-oh.
No. No, just lop it off.
I think no. They
Cut that out too.
Well, can I give you a quickie? Oh, I mean,
Fibrillation. So I cannot cut it out
we
'cause I can't say that word.
We just couldn't pronounce it.
Can you say that? Maybe that's what it was. Okay, back to it. We were going to do a podcast on atrial fibrillation.
Fibrillation. Okay.
I can't say fibrillation.
But
grab bear.
That sounds pretty right. I reckon that'd be spot on. Hey,
yeah, that's perfect.